flexion is supine. The hip and the knee on the test side are in the anatomical position. Would you say she's in the anatomical position? Okay. Well, not really, because the anatomical position is going to be more with the feet straight. And so that's one thing you're going to want to watch as you go up into the hip flexion, is that this foot's not turning out. Okay, so we want to kind of use that as a guideline. Keep everything lined up. What else does it say? Pelvis is in the neutral position, so we don't want her having a big arch in her back or being really rounded. That the ASIS and pubic symphysis are in the same frontal plane. The right and left ASIS are in the same transverse plane. So we just kind of want to make sure everything's straight, right? We don't want her shifted, laying sideways, or being rotated or diagonal. Okay, so everything's just kind of lined up. She's on her back. And then you're going to look at stabilization. So the therapist stabilizes the ipsilateral pelvis and the ASIS at the ASIS and iliac crest. So if we're going to assess her right hip flexion, my stabilization is going to be ipsilateral, ASIS, and iliac crest at the pelvis. Okay? All right. Okay, so then the distal hand placement is going to be doing the hip flexion, unless she's just doing active, right? But passively, it helps you figure out where your hand would go to do that. Okay? All right. It also tells you what the end feel should be. You see that? What's the end feel supposed to be for hip flexion? Okay, soft or firm. Soft if the person is kind of bulky in this area and they're running into their tummy, right? Or firm if we get to the end of the capsule, where the capsule is actually limiting the range. Those would be both normal end feels, okay? And then it tells you that it's a convex femoral head spinning on a concave acetabulum. So it also helps you figure out on the convex-concave rule which direction your joint surfaces are moving. Okay? So, looking at the next page, the start position is going to be completely flat. The hip should be at 0 degrees of flexion. Okay, so it's in the neutral position. The body is stabilized pretty much through body positioning. The axis is going to go over the greater trochanter. So we have to find the greater trochanter, okay? The way that you find the greater trochanter, the easiest way, I think we did this earlier, like I think the first lab, greater trochanter was one on there. Do you remember what landmark we kind of used to figure out where to start?
Pubic symphysis.
Okay, so right about the level of the pubic symphysis, and then on the lateral hip. So you're going to put your hand there, but you can use the flat part of your hand. You girls probably want to come up so you can see. If you can't see from where you're at really well, you're going to want to come way up here. Okay, flat part of your hand, and then I just roll the hip into internal and external rotation, and it'll pop right into your hand. And then once you kind of figure out, you know, you've kind of honed it in, it's pretty much right there, then you can use this part of your hand to find the greater trochanter. Make sure you're at the level of the pubic symphysis, because this is what people sometimes do. They're way up here on the iliac crest, and that doesn't really make sense, does it, to do your measurement up there? Because the hip joint is actually deep inside of here. So we're trying to basically do kind of a dotted line all the way through to the hip joint itself. So we use the greater trochanter because it's really the best landmark for that. So that is your axis, okay, or your fulcrum. So you're going to put the axis of the goniometer on the greater trochanter, okay? The greater trochanter is kind of a bigger shape, so go right in the middle of that as best as you can, okay? Once you get that lined up, your proximal or your stable arm, your stationary arm, is middle of the torso, okay? So with her, and we're going to kind of put her arm down so she's not arching her back here, you're just going to go make kind of an imaginary line through the middle of the torso to the shoulder, okay? And then your movable arm is going to be lined up. It's supposed to kind of follow the shaft of the femur. It's going to be lined up with the lateral epicondyle of the knee. Okay? So now find your own epicondyle. I think it's the condyle. Epicondyle.
Is it?
Yeah.
Where's the condyle?
So the epicondyle is going to be a little more precise because it's as it tapers down into the big condyle. So it's just right above that. So you find the big condyle and just right above that, kind of that hard, bony part of the knee, just above the big bony prominence of the condyle. Okay, do you feel that? Okay, so on her, and it's always good if you can, if your patient has on shorts or pants that can come up, to expose the area before you palpate, because clothes can make it a little harder to find things. Okay, so I'm kind of holding everything in place here. I'm going to find that lateral condyle and just go right up from that and find the little bony part that tapers into that. And that's my movable arm. Okay, this is where it gets a little tricky, is when she starts moving, I have to keep everything lined up with those landmarks. Okay, so this is a skill that takes a little bit of time, being able to hold your axis, maintain your stationary arm where it's supposed to be, because it's going to want to slip around if you let go of it, and then follow the movable arm. So it's active, we're going to say it's active range of motion, and I'm going to have her bend, and just bend your knee up, and try to bring your knee towards your chest as far as you can. Okay, so I can kind of repalpate and find that greater trochanter, which has moved a little bit because it moved kind of inferiorly, and before she gets a hip, a little spasm.
seam problem there.
Okay, then I've got to read my measurement. Okay, so come really close, because you need to be able to see this. Now notice where I'm reading it from too. Eye level. I'm not up here trying to read it. I'm down here right in front of it, and this is how you'll see it down in the clinic. You'll see your therapist down in front of the goniometer. All right, so when I was here, notice it's at 0 right there, okay? So my movable arm I have at 0. See that? And then what I have to do is follow, as I move it up with her, that same line that was at 0. Okay, you following what I'm saying? So we go to 10. I'm watching it go here. I'm not watching this guy so much. 10, 20, 30, 40, 70, 80, 90, right there. And if you look at this, that 0 line is now at 141. Okay? And come back down. And I don't have to take her all the way back down to 0 at the end. I can just let her put her foot down, take my measurement. If I wanted to do passive, and it's good to practice this too, this is probably one of the harder ones, because, and Marlene's tiny, so it's really easy. I can just take her through her range. But you have to line everything up, and then you have to kind of be down here to see it. Because to do passive, you have to be able to bring this whole leg forward. And it's got to be totally relaxed, and legs are heavy. Okay? But practice passive too. So I'll show you what that looks like. So notice I'm palpating midline of the torso, lateral epicondyle. Okay, and then I'm going to see if she can get to 0, so just relax as much as possible, Marlene. Just let your leg relax. Okay, make sure she can get to 0. Okay, and then I'm going to bring your leg up towards your chest, and I want you to relax completely. Okay. And just let me do the work, and let me know if you have any discomfort. Oop. Get underneath here. Let me do this a little differently. I don't know why it's feeling awkward. I haven't done a passive hip for a while. Right? Okay, now we're going to bring her up. So I had to just change my hand position a little. Okay, see, I mean, it's like, how am I supposed to keep track of what this thing's doing and monitor? and do full support to the leg, right? So you can just take
A
her all the
person who
way.
might be 2 or 3 times my
Right?
size.
And right, to someone who's maybe 300 pounds. So I kind of have to go back. I'm holding her here. Find that landmark, which is a little more difficult now because her knee's bent and her hip is bent. Okay, let's just try to go as far as can. And then I've got to read my number and then passively bring her back down. Okay, so another major thing to think about when you're doing passive is that you have to passively return them back to where they're laying down, their leg is down. Okay, you can